the spread rate is high. Second, having 30 mutations, the old immunity is not that effective. There is no need to panic, but we need to be cautious. Then what we saw in the second wave, the number of serious cases or the number of deaths would be substantially lower than what we saw in the second wave. India has a peak. What happens, there is an average. There is a peak in Mumbai right now, or we may see it in the third week of January. Other second-tier cities may see a peak in the first or second week of February, and villages or other cities may see a peak in the first week of March.
नमस्कार, India.com और हेल्थ साइट में आप सभी का स्वागत है। तो देश विदेश में कोरोना वायरस का नया वेरिएंट ओमाइक्रॉन जो है वो हाहाकार मचा रहा है। भारत में ही हर रोज इस वेरिएंट के केसेस जो हैं वो बढ़ते ही जा रहे हैं। वहीं इस वेरिएंट को लेकर कई सारी अटकलें, कई सारी खबरें हर रोज आ रही हैं। तो इसी पर चर्चा करने के लिए आज हमारे साथ जुड़े हैं डॉक्टर अनिरुद्ध अर्जुन मलगाओंकर, जो कि WHO के साथ कंसल्टेंट है। डॉक्टर, आपका स्वागत है हेल्थ साइट और India.com पर। So, doctor, my first question to you is that, we all know what Omicron is. It's come into India and we see a rise in the cases every day. So, doctor, the symptoms of this variant are very similar to flu. So, shall we take this variant very seriously? Because, recently a lot of guidelines have also come in from the government as to when you need to take the test and everything. So, and the symptoms are very similar to a flu. So, shall we take this variant Omicron very seriously or not?
For this question, there are two aspects. One, as far as the government is concerned, now as far as the prevention strategy at a national or the state level is concerned, it has to be taken very seriously. Because this is a variant, or as we put it, it is a deviant. Now, this deviant has a secondary attack rate or a spread rate which is 3 times higher than the earlier Delta variant. Moreover, it has 30 different mutations in it. Now, having said these two things, we will know that our older immunity is no longer effective against this variant, and it is 3 times more spreadful. Now, with that, we will know that we will have many number of cases. We will have many cases. So for prevention, the government has to be very cautious. Wearing a mask, strict maintenance of distancing, social distancing, avoiding gathering at public places, washing of hands. These things are to be followed as we used to follow in the Delta variant. One, as far as people at the household level or at the public level, there is no need to panic. I repeat, there is no need to panic, but we need to be cautious. As I have said, these 4 things, wearing a mask, maintaining social distancing, avoiding unnecessary travel, and washing your hands regularly have to be followed. And then, even with that, we will not have so many cases. Even if we have cases, let me tell you, the good thing is that even if the virus has a 3 times secondary attack rate, the virulence rate or the people who are admitted to the intensive care units or the people who require oxygen or the people who are dying are very, very low.
Right.
Okay. Earlier, when we had the Delta variant, we had around 30% of our cases were in ICU or required oxygen. And Today it has come down to hardly 8%. Even if we see the deaths, now a death is a bad thing, but we are seeing very low number of deaths or very low number of patients who are going to the intensive care units or who are, requiring oxygen or ventilators. Most of these people are requiring home isolation and they are getting better after normal treatment. The normal treatment is an antiviral, a secondary antibiotic to prevent infection, antihistaminic, and a painkiller or a antipyretic. This is the commonest treatment which is being given, and 99% of people are getting better in their homes. There is no need to panic.
Right, doctor. So there's no need to panic, but we still need to take it very seriously because, the transfer rate of this variant is extremely high. It's 3 times than the Delta variant or the other variants that have come in. But, there's no need to panic is what you're saying. Although, doctor, we're seeing that, a lot of statements are coming regarding the peak of the variant, that we might see a peak sooner in Delhi and Mumbai towards the end of this month. That is in January only, while all over India, we could see a peak in March, and then the mutations would subside and we could see that COVID would be treated as a normal flu. So what is your take on this?
now that I have said that the spread rate is 3 times, we will see a peak. There are two things. One, the spread rate is high. Second, having 30 mutations, the old immunity is not that effective. Okay, so we may see a peak. We may have, there are around 2,500 cases in Thane right now, coming up every day. And we may go over to around 4,000 cases by the end of this month. But still remember, 99% of all those cases are mild cases, which will require home isolation. Even with so many cases, see, even right now, Mumbai is still not in the peak, but still the number of cases have surpassed the peak of the second wave. We are seeing substantially low number of admissions today than what we saw in the second wave. We are also seeing large number of recoveries very fast. People are recovering very fast. That is why there is no need to panic. Even if we have a peak, even if we see around 2 times higher cases at our peak than what we saw in the second wave, the number of serious cases or the number of deaths would be substantially lower than what we saw in the second wave. That is one. Second, nowadays we are protected with a huge immune pool of vaccinations. In our second wave or our first wave, we were caught unawares. We did not have so much of vaccination. The government has also started with vaccination of vulnerable people like frontline workers, healthcare workers, people above 60, people with comorbidities. Also, the government has started vaccination of 15 to 18 children in the age of 15 to 18. Now, that is going to add to our immune pool and decrease our mortality and morbidity. One. Second, as of now, if we see the facility, the beds which we had in our second wave, we have doubled our facility and the occupancy is half. So only 25% of our bed capacity or ICU capacity is still being utilized.
Right. Doctor.
So even if the number of cases double or triple, we still will not face a situation wherein we will have a total, occupancy of our bed capacities, or what happened in the second wave. We will. I don't think that we will see this kind of a situation wherein hospitals are full and people are not getting beds.
Right, doctor. But a lot of speculations are there that we might see a peak in March in India, not only in Maharashtra but across India. So, is that viable? Is that possible?
Now that with a large number, it is a variant with 30 mutations, and our old immunity is not that effective. I'm not saying it is completely ineffective, but it is not that effective. So we may see a peak in end of January, first week of February, or first week of March. As far as India is concerned, see, India has a peak. What happens? There is an average. There is a peak in Mumbai right now, or we may see it in the third week of January. Other second-tier cities may see a peak in the first or second week of February, and villages or other cities may see a peak in the first week of March. But remember, even with that, most of the cases will be mild. 99% of the cases will be mild. Very few will be admitted to intensive care units.
Right.
And we will have very few deaths.
Right, doctor. Okay. That was it. Thank you so much for connecting with us and telling our viewers of India.com and the health site and making them aware of this new variant, Omicron.
Thank you. Thank you very much, madam.